we wanted to take some time this morning to highlight the link between food security and economic stability, and hopefully illustrate how a healthy food system is important not only to the health and wellness of the individual, but the economic strength of the community as well. Next slide. So this graph shows the components of a food system, and simply put, it is the process of farm to table. And even though these components have their own set of work streams and economic activity, they are interconnected. The success of one is totally dependent on the success of the other. Next slide, Diana. So this slide sort of gives us an idea of the breadth of the economic activity behind New Jersey's food system. So in addition to tax revenue, the industry is responsible for a large portion of the job sector in the state. And agriculture is a big piece of that state's total employment. So if you note too that New Jersey farms alone produced over $224 million worth of vegetables in 2020. And this doesn't include the other agricultural products that the state produces. For example, New Jersey is one of the top producers in blueberries, cranberries, peaches, apples, and tomatoes. And not to mention livestock, milk, and dairy product items, and in other farm products as well. Next slide. So with all that activity and abundance of food in the Garden State, which is the reason they call it the Garden State, there is still an issue with food access. So in a system of production, aggregation, distribution, and consumption, it's pretty clear that the problem is not on the production side. It's a matter of distribution and points of access. And COVID really highlighted this with the shutdown of large access points, such as schools, our businesses, and the smaller ones too, pantries, soup kitchens, and that sort of thing. So, and this was really evident when schools were closed and those kids receiving food through the school breakfast and lunch programs were really unable to participate because they were doing online learning at home. And the graph that you see from the Community Food Bank shows projected increases in New Jersey's food insecurity that are greater than the country's and the surrounding states. So this puts us at over 1 million New Jersey residents experiencing food insecurity, with 1/3 of them being children. And we also know that food insecurity can be experienced by really anyone. However, COVID exacerbated and highlighted the issues for households of color. Next slide. So there are also gaps in access to nutrition assistance, which only adds to the problem. Many eligible residents do not access federal food nutrition assistance programs, which equals millions of dollars left on the table. Only 81% of the eligible participants who are enrolled in SNAP in New Jersey. WIC participation is even lower. Only 57% of those eligible are enrolled. And as for our kids, summer nutrition programs serve only 22% of those eligible. And school nutrition programs serve only 57% of those students facing insecurity. Next slide. So on the health side of the equation, we as healthcare providers are very familiar with what the lack of healthy food and living in a food desert or swamp can do to our health. We see it in our outpatient facilities, our clinics, our emergency rooms, as many of our surrounding communities are food deserts and swamps, and they have been designated as such. So ironically, many people who are overweight or obese still suffer from hunger and malnutrition due to the food choices that are available in their or affordable in their neighborhoods. So it's disturbing to think that with all this lack of access, if you will, 4 out of 10 adults living in the US are facing obesity, and this number is higher in low-income areas. 50 health disorders are linked to obesity. 1 out of 3 children becomes overweight or obese before their 5th birthday. And finally, the cost on healthcare and direct and indirect costs. $1.5 trillion are spent annually for this issue. So this brings up the concept of the hunger-obesity paradox, which is more prevalent in low-income areas. So simply, the driving factor and logic behind this paradox is that people living in low-income areas must make the choice between affordable, convenient, and usually unhealthy food and the more expensive, inconvenient, healthy food. And making matters worse, low-income areas actually have more fast food restaurants and convenience food stores per square mile than affluent areas. And there have been some food density studies that show neighborhoods in these low income areas have an average of 2.4 fast food restaurants per mile compared to 1.5 fast food restaurants per mile in the higher income areas. Next slide. So looking at it from the economic side, food security actually drives economic growth. Some think of this as the other way around, but they are really interconnected. Having access to affordable food by creating more channels of distribution through both our anchor institutions and our local markets, as well as providing easier access to nutrition assistance, can actually free up budget dollars, which can be generated back into the community. So meaning nutrition assistance pours money back into the system, not only through the purchase of food, which in turn supports food businesses, including farming, but other necessities such as housing, utilities, and even healthcare. And eating healthfully also keeps people able to work and in the job market. And one note that I think is very important here is that for every SNAP dollar redeemed, a little over $1.70 is generated back into the community. And if you look at some of those unclaimed dollars we just spoke about, we can do the math and get an idea of just how much more we could be putting back into our communities with this type of assistance. Next slide. So the good news, hospitals are poised to be these anchor institutions in this space with our purchasing power and our expertise. This graph highlights ways in which we can, as hospitals, address these issues in our communities and including our first community of employees. I'm happy to say that we are really already doing a lot of these things and ready to take some of the programs to the next level. Next slide. So these next two slides highlight just some of our programs that address these issues. There are many more throughout the system, but I certainly am conscious of time and will hopefully be able to send everyone on this call a list of the things that we are doing in this space in every single facility. They provide healthy food, education, access to services such as SNAP, WIC, and senior farmers market vouchers, as well as clinical care. And working with organizations like the Common Market, as Linda had mentioned, the Community Food Bank of New Jersey, Sodexo, as well as our local focus and work with community food pantries, soup kitchens, faith-based institutions, and schools is what really drives the impact of this work. So for instance, in partnership with the Common Market, which acts as a broker between our farming folks and our businesses, we're delivering these fresh farm food boxes to pantries and soup kitchens throughout the system's footprint. We're scheduled to deliver close to 4,000 this year. And during the height of COVID in 2020, we actually delivered over 23,000. Each box contains fresh produce, eggs, yogurt, and bread, enough to feed a family of 4, and all from small businesses and farms that may have gone out of business during that time. And as an agency of the Community Food Bank, our Women's Wellness Pantry in Newark has connected over 1,000 women with food, education, and clinical care since 2019. And we certainly hope to expand this program as well. Next slide. You can go through the next, I'm sorry, Diana, 2 slides up. There you go. So our own Beth greenhouse, excuse me, one back, I'm sorry. Yeah, there you go. So our own Beth greenhouse and farmers market accepts SNAP, WIC, and senior farmers market vouchers, as I mentioned, in addition to providing the food and education that's so needed. But I am also proud to say that Newark Beth not only accepts these senior vouchers, but now helps distribute them. Last year, we raised our hands to help with this, as only 2 sites in Essex County were designated to do this function, and none of them were in the South Ward. We really felt that it was critical for hospitals to help close the loop in this space. And as for our employees, we have our farmers market and our Sodexo managed sites, as Linda also mentioned, and we're certainly hoping to expand that as well. We're also looking to create affordable, healthy meals that would be more convenient and on the go in our site cafeterias, and also hoping to expand an online farmers market in our facilities, connecting that farm food to our employees in a little bit more convenient way. Again, I mentioned there are many more of these programs throughout the system. It's just only not enough time to talk about all of them. Okay, now next slide. So looking specifically at local distribution, we are partnering with both the local and rural farmers and have created what we're calling our Food Hub Alliance initiative in both Newark and New Brunswick at the time, and we certainly hope to expand to other areas. This initiative takes a two-tier approach, if you will, working to create a strong business model for farmers by connecting them with anchor institutions like ourselves, as well as that grassroots approach that is so important to our local hub and market. So last year, we were able to connect close to 1,500 people with SNAP through all of these hubs, one of which was our own greenhouse, keeping in mind that we were not only feeding people, but giving them some extra room in their budgets for other needs. And finally, in this work, our relationship with the agriculture and farming industry has been key. We've partnered with almost 30 farms throughout New Jersey in both the rural and urban areas. One of our strongest partners is the Urban Agricultural Cooperative, who is here today to share his perspective. And our work with this organization, I think, is a great example of just how impactful some of these non-traditional partners can be, and how local grassroots efforts really can move the needle in this space and others.